Greetings from Bumrungrad International Hospital, and this is our first episode of Let's Talk About Health series. I'm Dr. Laura, Doctor of Pharmacy, and I'm your moderator for today. And I'm absolutely delighted to introduce our guest, Dr. Chantavat Chinakul.
Hello.
Yes, thank you very much, Doctor, to spare your time and be with us today. And thank you very much for everyone to join us today. Dr. Chantavat, he's specializing in gynecology, especially in oncological gynecology. And Dr. Chantavat, so that means he specializes in all types of women's cancer. As we all know, January is the Cervical Cancer Awareness Month. And today our topic is cervical cancer, what we should know about it. Okay, doctor, and I have the first question for you. So, what is cervical cancer?
It is the cancer that occurs in the cervix, and it caused by a certain virus called human papilloma virus. Formerly, we did not know what caused it. Have a lot of theory about what caused the virus. And some in the former time, we thought maybe it's herpes simplex virus. But last 10 years or something, we know about the HPV or human papilloma virus. So we know the cause of the cancer.
Oh, that's amazing. That means we can prevent it, right?
Yes.
We can talk about prevention a little bit later.
Mm-hmm.
And if you have any questions, please post them. And we will answer all questions after we finish our conversation with the doctor. Doctor will answer your questions. So the next question, of course, so what are the symptoms of cervical cancer? When we should be concerned and see the doctor immediately?
It depends because cancer have a variety stage of the disease. In the precancerous lesion or early stage 1, there may not be any symptom. Oh. And when it grow bigger and the stage progress to stage 2 or something, stage 3, the symptom may be like cervical discharge and coming out like vaginal discharge. And if it is stage 3, that the cancer spread to adjacent organ nearby, it may cause pain and may cause bleeding.
Mm-hmm. So that means if the woman has the vaginal discharge, it's better to like a normal one, right?
Yes.
Like it's abnormal something, she never had it before, yes. She should see the doctor.
Yes, but mostly because it's no symptom. Okay. So the best thing is to have check every year or regularly.
Oh, that's great. So can we talk a little bit about the screening, right? So,
yes.
Okay, so what kind of screening for cervical cancer is available at the moment?
Okay, so formally, we don't know what caused it. So we screen with the cell. We do the what's so-called pap smear. The pap smear is to scrape the cell from the cervix and spread it on the slide, and the pathologist will look at it and find out what is the cell. Is it normal or abnormal? But right now, we know that the virus caused the cancer. So we switch the method of screening to detect the virus in the first hand, in the beginning. So it is more accurate and more sensitive.
Okay, so all HPV viruses can cause cervical cancer, or there are some which is not that harmful for the body?
Yes, HPV virus have a lot of number in it, but the virus that cause cervical cancer we call high risk group of the HPV. It is about 15 number of the virus.
Oh, that's a lot.
Yes, and we can detect that from the beginning. So that is why right now we can say it's preventable, because we can detect the virus, or we can even have the vaccine to prevent it also.
it's a great news. Can we come back a little bit what you said before? So you straight away screen for those viruses,
Yeah.
right? But for example, if the cells are normal, so there
Yeah.
is no abnormality,
Mhm.
do you still screen it or not?
Pardon, what do you
Yeah,
mean?
if for example you have the screening, right,
Yes.
and all cells they are normal, so
Yes.
there is no abnormality.
Yes.
Do you just process the screening or not?
If the cell is normal,
Yep.
it means that the screening method is in the old way, the pap smear, screen the cell first.
Yep.
So and by mentality, when the doctor or the patient know that the cell is normal, they will not do anything more. They will just skip it for next year and wait until the cell is abnormal. That is the old way of screening. But right now, if we can detect the virus, okay, in this person, the virus is positive, we can detect in her cervix, then we proceed to next step of the investigation.
Okay, that's great. And now the next question. So how actually cervical cancer diagnosed?
Diagnose, yes. First of all, the most influenced way of diagnosis is through the screening.
Okay.
When we detect the abnormality, like we detect the HPV virus, we proceed to see the abnormal in the cervix. That if there are any abnormal part, by this method, we use the spatial scope called colposcope. It is a magnifying scope. Magnify the cervix. Look at it where it is abnormal, and the doctor will take the biopsy. Just a little piece of tissue nip out from the cervix, and that's we make the diagnosis of the cervical cancer or not.
Okay, so that's you have to do biopsy.
Yes.
So without biopsy, you cannot diagnose.
Yes.
Okay. So how often do you recommend to do the screening for women?
Formally, by the pap smear,
Yes.
we recommend yearly. Yearly because the sensitivity is not that much. There will be maybe 40% of negative, false negative. It means that if someone have abnormality, we will not detect in them 40%. So to compensate that, we do every year. This year we cannot detect, next year we may detect. But right now, by starting with the HPV, the sensitivity is very high. So if we screen by the HPV, by recommendation from the WHO, if one have negative HPV, they may skip the screening for 3 or 5 years.
Okay. Oh, that's very interesting, doctor. So it's actually changed in the practice.
Yes.
And quite convenient for women as
Yes,
well.
yes.
Yeah.
Because most of the women don't like to come to the gynae and have the examination.
Well, sometimes maybe women feel uncomfortable, but I would like to talk to our audience about that. It's important because it might actually prolong your life if you screen something on the early stages. So don't feel uncomfortable. Just come to see a doctor if you have any concerns.
Yes.
All right. So let's say someone was diagnosed with cervical cancer.
Yes.
Shall we talk about the treatment options for cervical cancer?
Okay. So roughly we will have 3 methods of treatment of the cervical cancer. First is the surgery. Secondly, it is radiation treatment. And third is the chemotherapy. That is the main 3 weapon or method that we use to fight with the cervical cancer. And it depends on which stage it is. If it is like precancerous or very early stage, we can treat with the easy surgical method like lead or conization. If it is invasive cancer, stage 1, maybe 2, we can treat with the surgery. But if it is 1, 2, 3. We may treat with the radiation treatment as well. So 1 or 2, it will overlap between surgery and radiation. But after 3 or 4, it may be only radiation and chemotherapy.
Oh, okay. So how soon someone has to make the decision on treatment? Because we all know the cancer is all about timing.
Yes.
As soon you make a decision, as better results. But how much time the person has?
So I may say as soon as possible. If one has know that they have cancer, they have to have the treatment immediately.
Okay. And can we talk a little bit about possible side effects of each option?
Okay. There will be side effect for each certain method of the treatment. Like if we start with the very non-progressive, non-invasive treatment like lead or colonization, still it may cause like difficulty in conceiving, mean that one who has the cervical operation, it may be difficult to conceive more than normal cervix, like that. And during pregnancy, they may have complication of the pregnancy like preterm birth or something. And for the more serious treatment like radical surgery, they have complication or side effect like urination or defecation or loss of the sexual sense or something. And for the radiation, a lot of radiation complication as well. If one does not have like proper treatment or even proper treatment, they will have certain number of complications from the radiation, like cystitis, mean that inflammation of the bladder or inflammation of the large bowel, something like that. And the chemotherapy, side effect of the chemotherapy, like we know, hair loss, nausea, vomiting, loss, lower white blood cell or something.
Okay, and if we're talking about treatment on the early stages,
Yes.
as you said, so the results obviously better.
Yes.
And you were mentioned about the sexual life as well. If it's early stages treatment, how it affects sexual life?
If it is very early, like colonization or lead, it may not affect at all of the sexual life.
Oh, that's great.
Yes, but if it is radical hysterectomy, the doctor has to dissect a lot of nerve tissue that is running along with the lymph node or something that the doctor has to take out. Radical means widely or more than normal. So to do the radical hysterectomy means that the doctor has to cut wider. So that means that it will include a lot of nerve tissue as well. So the sense of the sexual contact or something may be lost from that.
So the earlier we start, the better.
Yes.
Yes.
The early, the better for the doctor as well.
Okay.
It is a lot more easy and the outcome is a lot more better.
Okay. Yep. So let's say someone actually underwent chemotherapy. So it's anything you can recommend them to actually overcome some side effects of chemo and how to take care of themselves after they get in chemo?
Okay, I may say that the one who will take care of the side effect of the chemo should be the doctor, because the doctor will predict all the side effects of the chemotherapy: hair loss, reduce the white blood cell or reduce the red blood cell, or vomiting, nausea, or aching muscle pain or something, or feel weakness or something like that. Me as a doctor who prescribe the chemotherapy drug will give all the medication that will prevent the side effect of this. But for the patient side, they may have to comply with the treatment plan when we give the medication.
Yeah, they
or
have to
we
follow.
yes, they have to follow and recommend for the food and behavior modification, like a little exercise, or now you have to rest, you have to avoid contaminated food or something, or crowded place when you have low blood cell and it's easy to contact with the disease or something like that.
Okay, thank you, doctor. Quite clear. And that is very important question now. So what is the cervical cancer survival rate?
Okay, it have a dynamic or variety of the number. If one come with the early or precancerous, it will be 99% survive. So if it is stage 1 invasive cancer, the number may be 85% survival rate. So mean that
85?
Yes, 85.
It's very high.
Yes, but for it reduced when the stage 2
Yeah.
maybe come down to 70. Stage 3 now it's 60, 65 something. Stage 4 maybe only 20.
Mm-hmm. So we're talking about like surviving in 5 years, right?
Yes, yes.
Right, so as earlier we detected, it's better outcome.
Yes.
Right, so now the question about what cervical cancer treatments available in Bumrungrad, what our doctors can offer.
We can offer all of the modality of the treatment from the beginning, from the early or precancerous lesion or invasive cancer, or the radiation treatment, chemotherapy treatment, or the very aggressive surgical treatment like pelvic excenteration. We can do it at Bumrungrad Hospital. So I may say in Bumrungrad we have all modality of treatment.
So all options are available, yes.
Yes.
Doctor, I would like to ask you about the target therapy.
Yes.
Is it any possibility of this type of therapy?
Yes, yes. We now the targeted therapy we add to the chemotherapy as well, with the regimen of the chemotherapy. So we added with the treatment.
So an outcome obviously better.
Yes.
Okay. So right, thank you very much. That's very informative. So now we come back to the prevention of cervical cancer, because it's a huge question and very important. And as we all know, cervical cancer called as a highly preventable cancer.
Yes.
So I would like you to talk about that a little bit. How we can prevent it.
That is very important, because right now, after the era of the vaccination, the number or prevalence of the cervical cancer dropped down significantly. And now we have more coverage. Vaccination, it is a 9-valent, or the vaccine can cover 9 number of the virus.
Strains.
Yes, that will cover more than 90% of the virus that can cause the cancer. I mean the number.
Yeah, the strains.
The 9 strain maybe not so much when comparing to 15 strain of the virus, but the number that can cause virus will be covered because it has some cross reaction or cross effect. So the number that preventable may be up to 90%.
Oh, that's amazing.
Yeah, so I will strongly recommend the woman to have vaccination against this.
When do you recommend to do vaccination? Which age?
Normally start with in some country 9 years old, but in our country it's about 9 to 11. So the best is 9 to 11 because the immunity is very high. When we vaccinate, the immune response will be very high. But we can still vaccinate until 55 years old according to the study.
Oh, that's great actually.
And one of the information that you should know that even though you are you have contact with the HPV virus, or even you have like precancerous lesion, you can be vaccinated also. Because when you have the virus, that doesn't mean that your body will build the prevention immunity to the virus, not like vaccination.
Okay.
So someone may misunderstand that, oh, if I have that already, it's no need to do the vaccination. It's wrong. You still have benefit from the vaccination.
Oh, wow. That's kind of great news as well. And would you recommend women anyway, the girls, to do vaccination before they start sexual life?
Yes, that is the best option. That is the best option. But anytime is still good.
Okay. How about men? Should they get vaccination as well?
I myself have vaccinated myself.
Wow.
and I will recommend the one who have responsibility not to carry the virus to the one you love, or the other part or other group of men, like men, MSM, men having sex with men. They can have contamination or contagious, and they can have the disease in the anus also. And even the HPV can cause the virus in the nasopharynx.
Okay.
Yeah, so the answer is yes. I will recommend the men to have vaccination as well.
This is great. And we have in Bumrungrad all those vaccines,
Yes,
right? Everyone
yes.
can just come and have vaccination.
Yes.
Okay, this is great, doctor. It's extremely interesting, very informative. Thank you very much.
You're welcome.
And now we would like to look at the question what our audience sent to us and try to answer all those questions. Let's talk about the first question. Oh, what should the women do to prevent HPV infection? What women should do to prevent HPV infection?
The best way is to vaccinate, but the second best is to have safe sex, like condom can prevent some, but not all. I say some because the HPV can contact only touching. So anything that touch can bring the virus and get the disease. Yes.
Okay.
So condom can prevent some. I may say 50 or 60%, but vaccination is the best.
Okay, so vaccination and condoms you recommend, right? Okay, and I have more questions as well. After complete the treatment, what are the chances that the cancer will come back? Should I notice for specific signs or symptoms?
It depends on which stage.
Okay.
If one has cancer treatment and cure from that, the doctor will do the appointment and have the screening or check surveillance test every 6 months until 5 years.
Okay, for the first 5 years,
yes,
the patient should come back every 6 months and do the screening.
Yes.
Okay, so but the rates will be exactly, it depends on the stage, so we cannot exactly say.
Yes. Yeah.
Okay, so but what, for example, after the treatment and what the patient should, be concerned about, like what symptoms or signs they should be concerned after the treatment, and they pretty much, it's the sign then the cancer come back.
It is like invasive cancer.
Okay.
After surgery, they may have discharge. If more advanced stage, they may have pain or abnormal symptom inside, bloating or something, that the cancer invade to some organ like that. But if it is early, no way to have symptoms. Just come and have the screening or surveillance test.
Okay.
Yes.
Only then the cancer grows, and that's mean it just compress the nerves and the pain comes. Okay. Right. I hope Chemi is satisfied with the answer. Right. The next question from Chemi as well. Thank you very much. Right. That's all. HPV infection leads to cervical cancer.
Pardon?
All HPV
no,
can
no,
lead.
no, not like that. Only less than 10% of the HPV infected person will have cancer.
Oh, or any kind of HPV, right?
The high risk HPV.
Okay.
Not all the high risk HPV contact will have cervical cancer. The body can kill.
Okay.
Get rid of the HPV by itself.
Okay. So we actually can eliminate
Yes.
HPV by
Yes.
ourselves only 10%.
Yes.
Do you know why those 10%? What happened? Is it immunity problem?
Yes.
Or what's the...
I may say so. Yes.
Okay.
The immunity of that specific person is not so good, cannot fight with the virus.
Okay.
So the virus can grow and cause abnormal cells.
How about the age relation with that? Is it age related? Like the women, younger women
No.
have less chances?
The younger women will have more chance of eliminate
Okay.
the HPV from themselves.
Okay, so less chances to
Yes.
get cervical cancer,
Yes.
right? Okay. And what if you're talking about the age, right? What's the most common age you can see cervical cancer presented?
About late 30 to middle 40, 38, 39 until 45, something.
Mm-hmm. And how about the women who is menopause already? Does it relate to cervical cancer, like
No.
more chances, less
No,
chances?
I would say no effect from the menopause. It depends on how sexually active they are. They can get the virus, the new one coming in.
All right, from the sexual partner.
Yes.
Okay, doctor, thank you. All right, and we have one more question. It's very interesting. Is there any food that could help or should eat if patient diagnosed with HPV but still precancerous stage, or anything that could do during precancerous stage?
The only thing that has been studied and proven is the extract from the mushroom, spore of the mushroom, and it can boost up immunity of the patient to fight with the virus. But other kind of food, no, not really helpful. Only that. But the thing that may cause the disease to become worse is the cigarette smoking, and yes,
okay.
and poor behavior, like not enough rest, no exercise, something. But the worst is cigarette smoking.
So cigarettes, it's definitely
Yes.
actually make it worse.
Yeah.
Oh, how about alcohol?
Alcohol doesn't play much role in the cervical cancer.
Okay, only tobacco, right?
Yes.
Oh, that's interesting. Okay, and one more question. If I found and I got HPV infection, can I still have a baby?
Yes, you can, but have to be careful during giving birth. If giving birth vaginally, the baby, when passing through the cervix, will get the virus, and it will come.
Can be infected.
Yes, can be infected in the nasopharynx, and it can cause some problem there also. So I may recommend to have the cesarean section if one have HPV virus during delivery or the delivery time.
Okay. All right. So that's actually C-section is recommended, Kanchemi, right? And thank you very much for your questions. And if you still have any questions, please post them. And I would like to talk to you about other types of treatment as well. Like, how about immunotherapy? Is it any options available for cervical cancer?
Immunotherapy is not very promising yet right now.
But some research
yes, in some research and in some specific person, we may have to try for the response, but it's not really recommendation treatment right now.
Okay, and before we were talking about the surgical treatment, right, for cancer. So about surgical treatment, let's say it's early stage, we're doing the early stage treatment. How long the patients should stay in the hospital after that treatment?
If it is an early stage treatment, the people may not have to stay overnight in the hospital, like colonization or leave. But if it is like stage 1, they may have to stay in the hospital 3 to 7 days, depends on which method of the surgery.
Oh, so even on early stage, even it can be like outpatient.
Yes.
If you don't
Yes.
need even to be admitted to the hospital.
Yes.
This is great. And if you do this procedure like as an outpatient right process, so how quick the recovery process takes? So how quick is that?
The recovery?
Yes, after
If it
colonization.
is very early stage and like the treatment is very non-invasive, they can do normal activity the day after the treatment, just not having exercise for six weeks for me, or in some patients that their work, their routine work demand a lot of physical activity. I may say 2 months.
2 months.
Yes.
So it's quite quick, right?
Yes.
Oh, this is interesting as well. And that's the another question we were talking before about sexual behavior, right?
Yes.
Would you say that if the woman has, for example, more than one sexual partner during her life, so her chances of being infected with HIV going up, right?
Yes, of course it is.
Okay. So it's every potential partner can infect with her, right?
Yes.
Potentially. We
Yes.
don't know that for
Yes.
sure. Okay. And if we're talking about men, right, with HIV, is it any kind of cancer the HIV can cause?
Yes,
in
yes,
their
yes,
body?
yes. In men, the cancer of penis can caused by the HPV as well. About 25% of penis cancer caused by HPV virus. And the colorectal in anus, the anus cancer can caused by HPV virus. And in the nasopharynx as well.
Can cause as well.
Yes.
And the men can be infected by women as well, right?
Yes.
So it's both ways.
Yes.
It works both ways.
Yes.
Okay, so that's why the vaccination, as you said before, it's important to be vaccinated even if you're a man, because it will help with your health as well.
Yes.
Okay, and next question. For example, if we're talking about parents who worry about their children and they would like to vaccinate them, if they come to Bumrungrad, so which specialist they should see?
If for the children, they can come to women health, or they can go to pediatric department. Both. You can request for the vaccination in both departments.
Okay. Any screening should be done before that, or
No.
just vaccinate and that's
Just vaccinate.
pretty much all? Okay.
Yes.
And what vaccines right now available in the
It's
hospital?
only one vaccine that is coverage. It is the Gardasil 9.
So it's 9 strains,
Yes.
right?
9 strain. Yes.
Okay. And for the women, they should see Women's Center, right?
Yes.
For vaccination
Yes.
as well. Okay, and talk to the doctor first. Okay, so that's why, please, if you have children and you're worried about their health and you have any concerns about their future health, please be quite confident to see doctor and discuss the possibility of vaccination against HPV, because it's not only for girls but for boys as well important. Right, so anything else you would like, any other recommendation you should give to our audience about cervical cancer in general? Because, you know, when we hear cancer, it obviously sounds very scary all the time. So what should you tell our audience about that? Should they be quite concerned and scared about cervical cancer?
No, only 3 things. First, vaccination. Secondly, safe sex. And third, have a screening only 3 things that will prevent you from cervical cancer lifelong.
All right, that's amazing. Our audience, I don't think we have other questions anymore. And I think we actually covered everything, all sides of cervical cancer. And I would like to thank everyone who joined us today, because it's a very important session today. And thank you very much, Doctor. And Dr. Chantawat spared his time with us, and we have very important conversation about cancer. And I would like to encourage all our audience, if you have any concerns regarding your health, regarding your, if you're a woman, please come to see a doctor. It's Women Center at Bumrungrad. Or if you're not in Thailand, Bangkok at the moment, and you have any concerns, we can schedule telemedicine session. So please do not feel uncomfortable with that. We all know that the women's health, it's very fragile thing, and we have to really to take care about ourselves, right? So don't be scared, don't be uncomfortable, just schedule appointment with the doctor, or do the telemedicine at least appointment, so you will know better what's going on next, because the more we know, the better we can be prepared and protect ourselves. And I very encourage all parents to take care of their children's health as well, and be prepared so they can be prepared for their life, for their sexual life, and do vaccination. Please vaccinate your children. Please take care of yourself. And thank you very much for everyone today. Stay safe and healthy. This is Bumrungrad International Hospital. Dr. Chantawat, thank you very much. And Dr. Laura, and we are really grateful that you join us for today. Bye-bye.